Hello and welcome to my second video demonstrating my practice vital signs. I have with me my lovely lab assistant, Sadie. If you happen to see the red floof who's making her way over here, this is Nova. She might make appearances now and again too. So I had submitted a video earlier and I wanted to submit an improved video to show that I am in fact practicing. I've left myself some notes because I forgot to take the temperature in my last video, so I'll be making sure to do that today. So, like before, we're going to start by introducing ourselves to our patient. Granted, today my patient is, once again, my dog. She's not human, so she has no idea what I am saying. But, Sadie, hello. My name is Natalie. I am a nursing student, and I would like to take your vitals today. Is that okay? Yes. We're going to go with this is okay. Nova, go over here. Thank you. Once I've introduced myself, I'm going to verify that I have the correct client. Just like before, Sadie has her collar. I can look and see that the name on the collar says Sadie. 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 She's fully flopped. Normally when I call her, she perks up and makes eye contact with me. Sadie. Yes. Okay, so I have verified that I have the right client. This is in fact Sadie. Normally we would use two patient identifiers. I have just used Sadie's name. I happen to know Sadie's birthday. Like I said in the last one, I don't know the year of her birthday, but we could use a birthday if she was assigned a patient number, things of that nature to make sure that we have two identifiers. So I like starting with pain as the first of the vitals. Sadie, are you in any pain today? Pain might be one of the ways that we dictate any limitations or variations of our vitals. For example, if Sadie had pain in her left arm, I would not be taking blood pressure on an arm that already hurts. We would use her right arm, Nova, go over here, to take her blood pressure. Hi, baby girl. At this point, since Sadie cannot verbalize it to me, I'm just going to do a quick once over and make sure that nothing is in any great pain. She, of course, loves the belly rubs. Now, she does pull her paws away from me a little bit as I manipulate her. It's kind of just her reflex. But as of right now, I'm not hearing any yips, any normal pain responses that dogs might give. So I'm going to go with Sadie's pain is 0. For humans, we can use Wong-Baker faces, have them point to a face corresponding to a number, or just a typical 0 to 1 pain scale. 0 being no pain, 10 being you think you're dying or giving birth, or mauled by a bear, something of that nature. 10 is a lot of pain. So we'll start out with our first vitals metric, which would be temperature. Now, thanks to the pesky red floof of a puppy that I have, she actually ate my thermometer a couple weeks ago and I have not replaced it yet. So I'm going to fake a thermometer with a paintbrush. Now, in Sadie's sake, Sadie came to me a foster dog and she has some shyness and some timid qualities, so we have to take a lot of considerations when working with Sadie. I happen to know this because I know Sadie, but if this were an unknown client to me, we're obviously going to introduce what we are doing ahead of time, explain the process. In this case, I'm going to let Sadie sniff the paintbrush so that she knows what's coming her way. But I would ask before I do and verify, make sure that I have full consent and informed consent before I do these things to an actual human. So in Sadie's case, she is always very prone to ear infections. She actually frequently will run little fevers. But I know from a lot of experience that Sadie does not let me take tympanic temperatures, meaning in her ear. For humans, our expected ranges are about 98.6 is the average, up to about 100.4 degrees Fahrenheit. Now, dogs actually run very similar in terms of temperature. But again, because Sadie doesn't let me use her ears, we have to look for some alternatives. So in humans, of course, we have plenty of alternatives. There's the thermal scan of the forehead. Yes, sniff, sniff, sniff. Oh yes, does that taste good too? In the thermal scan, we would run it along the forehead, down the ear, and if they were sweaty, we would come behind the ear as well. You did so well, Sadie. Good girl. Good girl. In Sadie's case, I unfortunately have had to do her rectal temp quite often, especially if she is running a particularly high fever. Usually I can feel it. For Sadie, her nose gets very, very warm and her ears become hot to the touch. Hi, baby girl. As of right now, feeling her ears, she is not hot to the touch. She's not running any fever. As a further alternative though, I can also take an axillary temperature, sliding that thermometer probe at least halfway up there into the axilla and making sure that we hold a little bit of pressure so it's in there nice and snugly, and we can get an axillary temperature reading, keeping in mind that there might be up to a 1-degree difference between this and oral and a rectal temp. Hi, Sadie baby. She's such a trooper. After the temp, we're going to take her pulse. Now, Sadie is lovely. As a dog, it's actually very easy to feel their femoral pulses. We have done this many a time with Sadie. If we were going to do this manually, I have a watch. I can count either for 15 seconds and multiply my number by 4, or I can count for 30 seconds, multiply my number by 2. If we notice any irregular rhythms or any abnormalities, like bounding or weak pulses, then we could listen for a whole minute before we make a final pulse determination. I also happen to have a handy-dandy pulse ox. Now, because puppy paws are slightly different than human paws, obviously this is not going to work on a puppy paw. What do you think, Sadie? Now, when we go to the vet, they frequently will use her ears, but they have the little stick-on probes, and they can take her SpO2 measurements off of her ears. This guy, as it is fully intended for a finger and not for an ear. Now, dogs actually, you can do something just like cap refill on kids. If you come down here to where there is no more fur, I can pinch and release and watch the color come back. And in Sadie's case, it comes back in less than 2 seconds, which is what would be considered normal for a cap refill. For an adult human, if I were to put this on my finger and take my own pulse ox in lieu of Sadie's, then it will spit out a reading here in just a moment. My reference range for pulse ox for oxygen saturation is going to be between 95 and 100%. Obviously, at any point with the vitals I have mentioned so far and in the future, if anything is out of the reference range, it is worth verifying, noting, and potentially notifying the provider. I am currently starting at 99%, that is within the 95 to 100, and my pulse rate is 69 beats per minute. When it comes to pulses, we're looking for a pulse between 60 and 100 for the average human adult. Dog pulses tend to run a little bit higher, as do their respiratory rates. For Sadie, hi baby girl, we can take her pulse manually. Find that nice femoral. Yes, you do so good, baby. And I am counting for 15 seconds. In 15 seconds, I had a pulse of 16. If I were to multiply 16 by 4, now you get to watch me be really bad at mental math. That's going to be a pulse of 10 times 4 is 40, 6 times 4 is 24. That's going to be a pulse of 64. Sadie, you've got a very nice pulse. You must be very well rested. Huh, baby girl. Once we have our pulse, and in this case we were able to knock out our oxygen saturation in the same go, now we can look for our respiratory rate. Now Sadie is in a very poor position for checking respiratory rate, mostly because I cannot see both sides of her chest to check for equal and bilateral chest rise. Fortunately though, it is very easy to watch Sadie's chest rise from here, at least from this side angle. Also, she loves the contact, so it is too easy for me to rest a hand on her ribcage, feel those intercostal muscles working as she expands and decreases her chest size and takes those breaths. Now again, I'm going to watch and continue giving her little belly rubs, and we are going to count her respirations. Now I counted 3 in 15 seconds, which would put us at 12 respirations per minute. You heard the Sadie snore partway through there. That resulted in an irregular respiration just for that moment. Humans don't typically do that snore. That's actually very normal for Sadie, so I don't consider it abnormal. However, if we were watching her respirations and noted an irregular rhythm to her respirations, in her case, she had, relative to Sadie's normal, adequate, normal depth, normal rate, quality of respiration. For a human, if I were to hear a human make that noise while they were breathing, we would hang out and maybe listen, watch, and auscultate for a full minute. That might not be a normal human finding. But my final vital is going to be my blood pressure. Now, I do have my blood pressure cuff here. Sadie has seen this cuff before, but we have established that Sadie is not the biggest fan and does not care for it on an arm of hers. I have my alternate lab assistant, the pesky red Floof. She's asleep on the stone floor, and I am not going to disturb her at this time. Also, she's quite squirrely. They don't like it when I put this thing on them. It also does not fit them. Typically, cuffs are supposed to encircle about 40% of the upper arm. It's supposed to fit snug but not too tight and fit around the bicep. When we listen, we pump the cuff up to approximately 30 millimeters of mercury above the expected blood pressure. We let it out and deflate the cuff at a rate of about 2 millimeters of mercury per second so that we don't go too fast, so that we can ensure the most accurate reading possible. For an adult human, we're looking for a blood pressure of just below 120/80. That is average. It is considered elevated if it's between 120 to 129 systolic, but still below 80 diastolic. We hit hypertension stage 1 between 130 and 139 systolic. The diastolic would increase to about 80 to 89 for stage 1. Stage 2, we're looking at pressures above 140 millimeters of mercury systolic with a diastolic of above 90, and it becomes a hypertensive crisis when we break 180 systolic over 120 diastolic. That would definitely be time to let the provider know. That would also be a good time if this was taken electronically to get a manual blood pressure and verify that that was in fact an accurate reading. Hey, baby girl. And that is going to conclude video number 2 of Vital Signs Practice.